Hello, nerds. Woo! Are y'all ready to rock? Come on! Are y'all ready to rock? I'm going to give a talk tonight called Medicine That Rocks. We'll see where it goes. I have no conflicts. I'm used to giving talks at the, like at the med school, and I'm supposed to say, but those are my actual David Bowie socks, so I am proud of that. Just so you know, patient stories that I share tonight, there's no real identifying information in those. These have been modified, and we're protecting patients' privacy with these stories, okay? All right, so I am so psyched to know about Nerd Night Austin, and I feel honored to be here amongst fellow nerds. What I love about the concept of Nerd Night is just like Mickey was saying, like, being a nerd is being just excited, so excited about something that you're willing to like invest in it and embarrass yourself talking about it a little bit and learn about it and know more than the next guy. And something that I am absolutely nerdy about is using medicine in clinical spaces. And so that's what I'm going to talk about. I'm going to share some stories. We're going to talk a little bit about some of the research and evidence. I'm going to talk about some strategies, and then I'm going to tell some more stories. And there may or may not be some music along the way. Okay, there will be music along the way, and it's freaking awesome. So a little bit of background, guys. I live here in Austin. I was an ER doctor here for 10 years, and then I decided to go back for a year of training in a field of medicine called palliative medicine, which is very different from the ER. Instead of being sort of a first responder, it's kind of like you're a last responder. So you're taking care, in palliative medicine, we're taking care of patients who have a life-limiting illness of some kind. Maybe it's an acute thing in the ICU. Maybe it's a disease they've been fighting it for a long time, but there's no cure. And so our job is to help with the symptoms that they deal with, whether it's pain or nausea, fatigue, emotional symptoms, but also to help process what patients are going through and help families process it and make sure that their care aligns with their goals. And so a couple years ago, I left the ER and I underwent a year of training at Dell Medical School to become a palliative doctor. So very different experience. And early on in my fellowship year of training, I realized that some patient rooms in this field feel like this. And in particular, in my very first week in the hospital, I had a patient named Mikey. And Mikey had every reason to feel like this. He was in his 50s, and he had a really tough life, actually. A lot of mental health problems and a lot of isolation. And now Mikey was facing a new challenge, which was cancer. And it was cancer that had spread. And so we were consulted to see if we could help out, because Mikey was kind of a hard nut to crack. And the doctors were really kind of flummoxed that Mikey didn't want chemo or radiation, No thank you was basically the answer. And in fact, when we talked to him, he would say things like, just suck all the oxygen out of my lungs and let me die. And it was pretty gloomy, to say the least, in his room. But, that's where he was at, and our job is to meet people where they are. But every day, I tried to turn on the charm. I tried to tell stories. I tried to ask provocative questions or use some humor, and I just couldn't get through to Mikey. Until one afternoon, I circled back to Mikey's room, and I'm looking at him, and just something about his appearance. I don't know if it was his teeth or his long gray hair, but he reminded me of this guy who taught me guitar lessons when I was 12 years old. And I sat there and I'm like, you know what? This guy looks like an old rocker. I bet he loves classic rock. Just something about Mikey tells me that. So I asked Mikey, hey, can I play you a song? And he just sort of growled at me, yeah, I guess. And for whatever reason, this band came to mind. Anybody? Thin Lizzy, baby, straight out of Ireland. And I dialed up the song, The Boys Are Back in Town. Y'all know that one? And on my smartphone, and I turned up the volume, max volume, and this happened. And for the first time all week, this is how the room felt. And Mikey lit up, and he smiled, and he no longer hid his rotten teeth or anything about his backstory, and he started telling me stories. And he started telling me about his brother and about concerts they used to go to. And then he stole my phone and started playing me songs. And I was just like, what is going on? This was just incredible. And I stepped out of the room, and I thought, A, was that illegal? And B, what the heck just happened? That was amazing. I'd never been a part of anything like this. So a little bit later on, probably the same month, early on in my fellowship year, I had a different patient. And that patient was actually not Vanilla Ice, unfortunately, but this young woman named Erica, who kind of had a similar trajectory to Mikey, just dealt with a lot of depression, a lot of isolation from family and friends, and now was in the hospital in the ICU dealing with life-threatening cancer. And I mean like acutely life-threatening. And Erica had had surgery after surgery, was really touch and go, and was just in the ICU. And one day my attending doctor, like my boss, my educator, a guy named Greg Wallingford, who's awesome, was in the room, and she's unconscious. And the song Ice Ice Baby is playing on the TV in the room. And this is what he sees. Dun 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 dun. Her hand is moving to the music. And he's like, wow, okay, put this in the back of. And so the next day, I'm talking with Greg, and he goes, hey, Tyler, I think Erica was dancing to Vanilla Ice yesterday. I'm like, oh, no, that's too good. Let's find out about that. So we go to Erica's room, and a big thing has happened in her care in those 24 hours. She no longer has a breathing tube in her mouth. She's had a surgery to get a tracheostomy, which is a breathing tube in the neck. So now we can see her face fully. Now she can't vocalize her words yet, but she can mouth things, and she can interact with us much more than before. And we said, hey, Erica, by any chance, were you dancing yesterday to Ice Ice Baby? And she smiled and lit her eye, and we're like, oh, no way. That's incredible. Well, at that time on the TV was another song was playing. It was Party Rock Anthem by LMFAO, Party Rock is in the house tonight. So we said, oh my gosh, you must really love the song Ice Ice Baby. Remember, she can't speak. She gets these huge eyes and looks at us like we're crazy. No, I don't love that song. Well, you must love this song, Party Rock Anthem. Now she looks mad. Like she's offended. No, I do not love this song. So now suddenly we have a very real sense of urgency. We need to find out what music Erica loves, because clearly she's dancing to Ice Ice Baby, a song she hates. So I'm like, hey, Erica, what's your favorite song? Well, poor thing, she can't vocalize. So I'm like, I'm so sorry, I'm such a fool. Let's go by categories. Is your favorite song hip hop? No. Is your favorite song country? No. Is your favorite song pop? No. Is your favorite song R&B? Yes. Is your favorite song old R&B? Yes. And then, divine inspiration. Is your favorite song September by Earth, Wind, and Fire? Yes! And I dialed it up. And that is exactly what happened in Erica's room. She is in the bed. She has a breathing tube in her neck. She's got all these IVs, and she just starts dancing like you've never seen. Her head and her neck and her shoulders. Her hands are still restrained, so she's not pulling at things. And shoot, we had to answer the call. So me and Greg, we start, we're like the dorky middle-aged dads at a wedding, like, yeah. Well, next thing you know, Erica's dad, who'd been sitting in the corner for weeks, gets up and with his walker starts dancing with us. And we have a dance party right there in the ICU. And a surgery intern comes to check on Erica, and he walks in the room, and immediately walks out. Got the heck out of there. He's like, well, I don't know what that is, but I don't want anything to do with it. And we danced to another song by Earth, Wind, and Fire. And man, a lot of things happened that day, but Erica's need for pain medications dropped by 90%. And that's not all because of September, but I know that played a significant role. So here I was in palliative medicine having all these experiences with music and patients, and I started thinking, well, there must be something to this. And so I started looking into just this overwhelming body of research that exists that supports music in healthcare. I found a couple things. One, there's something called music medicine, and that's essentially what we were doing. That's people in healthcare who are not music therapists playing recorded music for patients. Okay, that's music medicine. We also found, and then we knew what music therapy was. That's having music therapists come along. Sometimes they play recorded music. Sometimes they play live music. Sometimes they help patients create music. They record heartbeats. They do all sorts of cool things. But unfortunately, the hospitals where I work, no music therapists. So I don't want to deprive my patients of this benefit just because we don't have music therapy. Well, there's some really cool studies out there. In 2016, in the Journal of Music Therapy, they looked at 97 previous studies that had to do with music and pain. Most of them were actually music medicine, so playing recorded music for patients. And whether, did we just die? Oh, no worries. And whether it was like inpatient, outpatient, chronic pain, acute pain, all of it worked. And whether it was a music therapist doing a direct intervention or whether it was somebody just playing recorded music, it all helped reduce pain. There's a 2019 meta-analysis and systematic review where they looked at 11 randomized controlled trials, and they found that music therapy improved pain, quality of life, anxiety, emotional function. It didn't make any difference in fatigue as measured objectively, but it helped in all these other ways. And what's interesting is when you look at the 11 studies that they reviewed for this systematic review, you know, it involved a lot of things. There was live singing, there was something called an ocean drum, there were all these different therapeutic pathways, but a number of these studies were just playing music on a CD or on an MP3 player. That kind of dates the study, right? MP3 players. But it all helped. That's the point. A friend of mine up in Montreal did a big systematic review of the effect of music on pain in the ICU in adult patients. And after looking at all these studies, they surmised that patient-preferred music for about 20 to 30 minutes can lower pain scores by about 2%. And that means it could be Vivaldi, if that's what the patient wants, or it can be Kiss. You know, whatever you need, whatever works for that patient is the key. And then there's more evidence showing that this music helps for caregivers as well, meaning loved ones. So it's just kind of an overwhelming body of evidence out there. So here we have with music something that improves pain, anxiety, depression, quality of life, emotional function. Patient preference seems to matter. All sorts of formats work. Guy with a guitar, playing something on your phone, it all seems to work. And there are no dangerous side effects, unlike all of our medications, right? Something else that I discovered is that once you've played Biggie with a patient, you have a new bond. There is a new therapeutic relationship. And let me tell you this, if you've ever played Fat Pat with a patient, there's no looking back. Right there.
Love it, man.
Yes, Fat Pat has featured with more than one patient at our hospital. But as we were, Greg and I were doing all this work with our smartphones, it was just super amazing. But we were kind of thinking, well, this is great. It's affordable. It's in our pockets. But we're kind of messing around, and we've gotten real comfortable with this. How do we make this accessible for other doctors? So we thought back on really what is it that we're doing, and how can we relate this to other people? And we realized that we were citing evidence. Do you know there's a lot of evidence that this helps? We tell our patients this. So it's not this crazy, awkward moment. We also then normalize it. We say, look, yeah, we share music with a lot of our patients. And now we're sort of like, okay, I'm less, as a patient, now I'm less freaked out by this experience. And then what I noticed is that when I would ask people, hey, what's your favorite song? Now, it worked with Erica, but generally speaking, if you ask somebody what their favorite song is, that is an intimidating question. Nobody wants to answer that. So instead, you ask something like, what's a song you want to hear today? Or what's the song of the day? Or what's my outro music as I walk out the room today? And people are have a much easier time answering that question. And then we also notice that when we push play on a song, we need to be ready for whatever comes next. We might experience any number of alternatives in terms of responses. And the last thing we want to do is empower patients and families to repeat this experience. This is a tool not only that we have, but that they have in their pockets. And we want patients to experience this. So we've had so many cool experiences. I don't know, anybody know Jose Jose? A Mexican balladeer, just a beautiful moment of catharsis with a patient, kind of coming to terms with the illness she was facing, and with her family. Taylor Swift is great for anxiety for some patients. I don't know that would work for me, but it's worked. Desperado, I've seen crusty old dudes just kind of like open up and tell their life story when they hear Desperado. So just great things can happen. You just don't know what's going to happen. One of my very favorite moments of sharing music with a patient, anybody recognize what movie this is from? Shawshank Redemption, that's right. So we had this this really tough situation. An old man, I've referred to him as Mr. A for a long time, so I kind of can't think of him as anything else. And Mr. A was in the hospital. He had pretty advanced dementia. And in the hospital, he was really dealing with a lot of delirium and confusion. And when we would check on him in the mornings, he would tear up because he knew that he wasn't processing things right, but he couldn't process them right, which is kind of the worst place to be, that kind of middle ground where you know it's not working, but you can't make it right. And it was so hard and frustrating for him. And one day I asked him if there was any music that he would like. And he kind of mumbled, and we heard the word classical. Okay, classical. And then we said, okay, like what? And we heard him say, Mozart. And it sounds like the movie Amadeus, right? Like, Mozart! But that's the word we heard. And I at that time had one Mozart song just like ready to go on my phone, and it was the song that they play in Shawshank. I don't know if you remember, but Tim Robbins' character breaks into the loudspeaker room and plays The Marriage of Figaro on the loudspeaker for all the prisoners. And Morgan Freeman, as he's narrating, he says, and for that moment, every prisoner in Shawshank felt free. And I think that's what happened with Mr. A that day. So just allow Mr. Mozart to take you away a little bit. And I tell you, as that song played and after it finished, Mr. A became the most beautifully coherent man on the 7th floor of our hospital. He actually said, that music, when I hear it, I feel it go straight through me. And I feel at ease. And when I'm recovering from a surgery or a procedure, that classical music makes it all better. And it was just so moving. And we stepped out into the hall, and I was so glad I had some learners with me that day. I had a med student and a resident and a fellow, and they were like, what just happened? Was that a Disney movie? No, man, that's Mozart. Like, this can happen every day in our hospitals. It doesn't have to be a magical experience. It was so moving, though. And so as we've sort of played around with how to bring music to our patients in the absence of dedicated funds for music therapy, we thought about, are there other media that we can use? And speaking of, you want to nerd out? I can nerd out about vinyl for days. And we started thinking about, what if we had a record player? Like, that's interesting because that's like a novelty. Everybody has a smartphone, but a record player is an event, So we actually, scrounged up some funds, and we got a little record cart and a donated record player, got about 50 records, and we named our little project ATX Vinyl because, we're in the ATX. And then we figured out how to spell ATX Vinyl, so we called it the Audio Therapy Experience, vinyl for inpatients near the end of life. And we had this little cart, and we're still using it today. It's for patients who are, really, mostly it's for patients who are in the ICU, who are nearing the end of their life, that we can't fix their disease. And at times we take the ventilator and the life support machines out of the room, and we bring in the record cart. And what's so great about it is that it gives families and loved ones agency, and it gives them opportunities to support their families. So we leave it with them and say, hey, do with this what you will. This is our gift to you. You can, and they flip through the records, and they find one, and they look at the art, and they smell the cardboard, and they flip it, and they put it on, and they turn it on, and then the needle drops, and you hear the little cracks and pops, and the song plays, and it just takes them back. It takes them back to the living room. It takes them back to their childhood. And I tell you, it's just been so wonderful. I'm here to speak. I love the virtues of vinyl. Music is music, but man, when it's delivered this way, there's just something different. It's also very inexpensive. So that's nice too. I mean, relatively, it's more expensive now, but it's like a hospital can afford this. We've had so many cool experiences. If you're interested, this is a QR code that shows our vinyl collection on discogs.com. If you're a collector, you might know this site. But we've got just records from all sorts of different genres that really resonate with people. It's been super fun to grow the collection. One of my favorite, one of the first families that used our record player, they grabbed Fleetwood Mac, Rumors, right? Everybody loves this album. And they were a first-generation family, and they were, I don't know, they were roughly, the grown children were roughly my age, and this, I just think that their experience with Fleetwood Mac Rumors might have been similar to mine, but I also think that the song Don't Stop Thinking About Tomorrow might have meant a little bit more to them and their family. And they said when they played that record, it was like they were back in their living room at home, and it was just so beautiful. And they kind of got to partake in the care of their loved one. And then we had this guy who, like, against all odds, survived an ICU stay. We were sure that he wasn't going. I mean, we did everything we could for him, but we were sure he wasn't going to survive. And one of our residents was like, you know what? He deserves a party. He needs to celebrate. So he brought the record player into this guy's room while he was still in the ICU. And this is how he celebrated. And they said when that music played and the record player spinned, he felt human for the first time in weeks. In this sterile environment, there was a joy present that had not been there. And it's just the power of music, guys. It's touching the human side of our patients. And it's just there for the taking, and we need to do a better job of this. I want y'all to imagine that you're an old Texan, and now you're stuck in a scary ICU stay, and it's an uncertain outcome. And then somebody comes in, brings in a record player, and you hear this. God bless you, Willie. One quick note on another way that music is super powerful is that there's more and more research being done about the power of music to help people in healthcare, people who are delivering the healthcare. A friend of mine, Carolyn Phillips, here at UT, has done lots of research about songwriting programs for oncology nurses, where they pair a songwriter with an oncology nurse, and they write a song that helps tie them back to meaning, to what brought them into medicine, to what brought them into this hard work in the first place. And now she's doing music with bereaved families. And Darden Smith, who's the musician in residence at UT, does work with veterans. And just the whole process of song creation has been a very powerful tool. I've personally found that music is a great vehicle for storytelling, like tonight, but also writing stories. I ended up with this whole kind of blog series called my palliative mixtape, and it was like each song kind of told a story during my fellowship. And now it's turned into a podcast, which is super fun, and I'll give you a QR code to it, but called My Medical Mixtape, where we talk about stories like this, but then also we bring on people in healthcare, amazing doctors, inspiring doctors, but who may be burnt out, or nurses who are struggling. They talk about the music that means a lot to them and how that ties them and kind of keeps them going. So music is just a super powerful tool. I just want to close with some thoughts. Mickey, am I okay to talk about Houses of the Holy real quick? I want to talk about Houses of the Holy by Led Zeppelin for two very important reasons. Number one, anybody know this album? Okay, a lot of hands, good. When we were collecting our records for the record card, the nurse on our team, who's sort of like our conscience on our team, she's this amazing woman who's a lifelong Austinite, and she said, we're going to need some Led Zeppelin on that card, right? And I loved that. It was very serious. Like, we need Led Zeppelin. It's like, hey, I get it. She said, we have a lot of patients where Led Zeppelin is going to matter to them, and it needs to be Houses of the Holy. And honestly, that was the first Led Zeppelin CD that I had ever owned, and it had Over the Hills and Far Away, and it had the Rain song on it, and I was like, you know what? I get it. I think you're right. I think we do need Houses of the Holy. And we had a patient a little while ago who was in his 30s, and it was really just a sad situation. He was estranged from his family. Family wasn't able to come visit, and now he's in the hospital, and he is not going to recover. His organs are just kind of shutting down one by one, and there's nothing that the medical teams can do to help this man, and he's now unconscious. And the nurses were finally able to get in touch with the family, and they say, hey, just so you know, we've been keeping the room real peaceful, and we've been playing some light rock for him to keep him comfortable. And the family said, whoa, no. No light rock for this man. We're like, oh my gosh, we would have no idea. Said, no, please deliver some hard rock to his room. This is offensive to him. It's like, well, the nurses are just, they're trying. Anyway, so we're like, okay, we need let's bring in the Zepp, get the lead out. So we bring in Led Zeppelin, and really, like, right at the end, as his body is starting to shut down, and he's unconscious, and the room is very peaceful. And it's very calm, and we play for him songs that we now know meant a great deal to him. We play for him Over the Hills and Far Away. We play for him the Rain song. And I'm so thankful that young man had something that spoke to who he really was in his final moments on this earth with us. And I'm thankful that he wasn't alone. And I know that his family is thankful that he wasn't listening to Hall & Oates, because that would not have been right. But the other reason I mention Houses of the Holy is because the very title of that album is a constant reminder to me that it is really a sacred space, being at the bedside with patients, especially patients who are facing serious illness. And we need to elevate our game. We need to make sure that we are tending to these humans that we get the privilege to care for at the bedside. It really is a sacred space, and we need to live up to that. And one of the ways we can do that is to honor them and the things that make them unique. This is a 1 in 8 billion miracle right in front of us, and we get the privilege in medicine to spend some precious moments with them. I just have a couple final thoughts. music is good medicine. We need to fund it. If you have rich friends, in the absence of dedicated music therapy resources, we've got to get creative. I think that music is just one way to really reach that human inside of each patient. There are lots of ways, but we need to be seeking that always in medicine. Sometimes I think our greatest gifts of compassion are just presence and curiosity. Like, what makes this person tick? And then we in medicine need to always remember the specialness that we have, the gift to be at the bedside. So thank you so much for listening. I love this stuff, and I just am so grateful for this group and to have this opportunity to share with y'all. Thank you so much.
All right. Well, thank you. That was amazing. I've seen 300 Nerd Night talks, and this is the second one to make me tear up. First one was about parasitic flatworms. Very touching.
I'm tearing up right now,
Yeah.
just thinking about him.
Yeah. Who was the first question? Oh, I got to go with our AV.
There we go.
Thank you very much for your talk. It was great. I have
you.
2 questions, a quick one. Are you taking donations at all for like records, CDs, anything like that?
Absolutely. Yeah.
How do
Hit me up with that email address. Yeah, thank you. Thank you.
Second, you touched on this briefly, that this is really hard work for you and everyone else. What's like music that you like to listen to when you're feeling blue?
That's thank you for asking that. It's really funny because my family and my kids, they think I'm crazy, but believe it or not, The Boys Are Back in Town became my meaning. I would drive into the hospital, I know I'm going in to do hard work, but I would listen to The Boys Are Back in Town on the way to work. It's like my meaning-making song because it just reminds me of Mikey and who is this person and who do I get to care for? So that's one of them. Do You Realize by the Flaming Lips, if I want to get a little bit more emotional but not fully. That song is just a crusher. It's so beautiful. I love it. I can listen to it on repeat. And then I would say that when I've dealt with burnout the most, the song Madam George by Van Morrison it's kind of like one of the most beautiful songs to me. It's off of Astral Weeks. So lots of different things, And I don't know that the meaning of those songs is universally applied. Do You Realize is kind of on the nose, but the rest of it is more like these are part of my experience with them, and I don't know that they would mean the same to other people because it's not necessarily based on lyrics. It's more like what was my experience with that song at a given time. I don't know if you feel the same way. Yeah. Yeah, absolutely. Oh, please do. Yeah, thank you.
With the awareness that this is not your specific specialization, is there any worry or notion of a desensitization with music medicine, in that it can be overused and lose what positive effects it can have?
I'm so glad you asked that question. Absolutely. So one of the things about music in the hospital setting in particular, which is the one I can speak to the most, is if it's constant, it drones on and it loses the uniqueness, right? We're talking about, think about the record player. This is sort of like Deus Ex Machina, whatever that phrase is. This is sort of like this out of nowhere thing that comes and elevates the mood. Or a song on the smartphone. It comes out of nowhere and I think it loses its power if it's constantly on in the background. Think about the joy of hearing a Christmas song. Now think about working retail during the Christmas season. Now you hate Wham. You want to kill Wham. They're the worst. So I love hearing Last Christmas, but it's because I don't work retail. So I do think that you can desensitize by overstimulation. It's no longer firing. It's almost like an opioid medication, right? You can become where I used to do a little, but a little wouldn't do it, so the little got more and more. Like Mr. Brownstone by Guns N' Roses, but I do think you can get desensitized to it. So I think that the one study I cited where they used 20 to 30 minutes kind of dedicated of music that's patient preference is powerful. I don't think it's fully been studied, but it's kind of intuitive that if we just kind of crush somebody with music all the time, that it loses its potency. Is that kind of what you were getting at? A little bit? Maybe not. Uh-oh. More or less? Yeah. Yeah. But I think there's something to that. Absolutely.
Next question. I have a question.
Please.
The acronym.
Which one?
I don't remember it.
ATX vinyl?
Yeah, the
Or
one that
the
has
endearing approach?
endearing. The
Yes.
EA. Do you ever get a response that's not positive?
Very rarely. It is possible. So the more than a negative response is a non-response. And with a non-response, the great thing is you control the volume, and if it just seems to just be like a dud and it's not going somewhere, you just slowly turn it down and start talking over it and move on. If you're asking the patient for permission to do it and you're letting them guide the music selection, then it's very rare that you would have a negative experience as a result. If you are coming in and you are insisting on if I'm bringing Thin Lizzy to the wrong patient, that could be a very negative experience. In fact, Hilary Moss, if anybody wants to email me, there's a great book called Music and Creativity in Healthcare Settings by Hilary Moss. She's out of Ireland. Just a really accomplished music therapist who writes really well about this. She absolutely, one of her chapters in her book is about how music can do harm. And it's kind of funny. You think, how can music do? Well, it can. If it's the wrong music, if it's not desired by the patient, if it's not desired by the family, it can. So usually when we're asking them to lead the way, it's not causing harm. That is a hard thing to measure. So I can just say anecdotally, it's rare. And if we're letting the patient steer the ship, then it's usually pretty good. But thank you for asking. I mean, all interventions, all human interactions can have, all drugs have, Tylenol has bad side effects, right? Every medical intervention, even music, can have bad side effects. So, great question.
All right. I think that's it for questions. Thank you so much.
Thank y'all so much. Go Nerds.